Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. In this bonus episode, I caught up with Caitlin Rivers, Senior Scholar at the Johns Hopkins Center for Health Security. Our topic is voting and COVID-19. Let's listen. Hello, Dr. Rivers. Thank you so much for joining me. And our topic today is voting. So this is a big deal this fall.
Yeah, thanks for having me back to chat about this.
So take us through the different kinds of voting, and then we can talk a little bit about the risks and how people can protect themselves.
There's a few different options, and the options that are available to you and the dates that correspond to them varies by state, so you will have to look this up. But there is mail-in voting, where you cast your vote by mail. There's early voting, which is usually in-person voting, but starts much earlier than Election Day. And then there's Election Day on-site in-person voting.
So there's been a lot of attention to mail-in voting. And obviously, if people are filling out their ballots at home and mailing it in, they're not at risk for getting the coronavirus through that process. But not as much attention to the actual risks of voting in person. So could you talk a little bit about how you match up those risks with the risks of other types of activities?
Yeah, I think with reasonable mitigation measures at polling sites, the risk of in-person voting could approach that of visiting the grocery store. I think for polling sites that are held in large locations, which they normally are, like gymnasiums, that have hand sanitizer available, or you could bring your own, and that minimize contact between people with social distancing, I think that starts to look a lot like the grocery store and is reasonably safe. I think what I would want to avoid is waiting in line for a long time inside, but that would be the one kind of unique hazard that I see of in-person voting.
So early voting, is there an advantage there, you think?
I think early voting is a good option because it allows you to go at a time when it's less busy. And so you're more likely to avoid other people. I think that's the plan that I intend to use.
And what should someone who is voting in person have handy? What are their set of tools to bring to the voting place?
Absolutely wear a mask and bring hand sanitizer. I think largely the same tools and thoughts that you carry with you when you're headed out to the grocery store or some other place in the community will be exactly what you need for in-person voting as well.
Some people may be concerned about their local polling place. What recommendations do you have for them to find out more or to assess the risk to them based on the plans being made?
I know many polling locations are taking the risk of coronavirus very seriously and have made available plans about what they do to reduce risk. If you would like to in-person vote and you are worried that your polling place will not be safe enough, or you have special conditions that put you at higher risk of severe illness, there's a couple extra things you can do to make it even safer. You could wear a high-quality mask like an N95. You could wear eye protection, and you could minimize your time inside the building, for example, waiting in line outside.
Now, the flip side of people going to vote is the fact that there need to be poll workers. And the poll workers obviously are going to be there for more extended periods of time. They can't just zip in and zip out like voters. And we've heard that there are a lot of poll workers who are older adults who may be quite nervous about the risk of getting COVID-19. What do you recommend for poll workers?
I think poll workers would also be good candidates for wearing a little bit of extra personal protective equipment, either a surgical mask or an N95 and perhaps eye protection. If you are spending a long time indoors with a lot of people cycling in and out, that would put you at higher risk of transmission. And so I think it's good to find extra opportunities to reduce that risk.
What about age? Is there an age where you would say people shouldn't be a poll worker? Or, how I've heard from people who are quite nervous in this setting.
It's true that the risk of severe illness increases with age and is higher for people with underlying health conditions. There is not really a drop-off where you can clearly say 50 is safe and 51 is not. It's really the risk increases with age. And so particularly people who are, I would say, over the age of 60, 65 would probably want to either consider whether they have underlying health conditions that put them at even higher risk or speak to their doctor.
Right. And really check out what protections will be in place for them in their particular location before signing on.
Absolutely.
Sort of creates an opportunity for a lot more and younger, potentially poll workers.
Absolutely. And it is such an important community service function. And so I have the greatest respect for poll workers. And I think it is difficult this year that many poll workers are older. And so places are trying to find new volunteers.
What other factors do you think should be part of the discussion about voting in person in the middle of a pandemic?
The greatest risk for polling sites is the level of virus circulating in the community. So places that have very small number of new cases will be safer than places that have a lot of virus. And so I think that also factors into considerations about what risk looks like on election day.
So let's talk about election day. Somebody wakes up and they're not feeling well. Say they have a fever. What would you say to a poll worker with a fever, for example?
I think anyone experiencing COVID-like symptoms would not be a candidate for appearing in person. If you're able to access a diagnostic test, particularly a rapid one, I think that's an opportunity to get cleared before you head in. But if you are not feeling well, have a fever, then you shouldn't go.
Would that also be your advice to people who might have to vote in person?
That's a tough one, but I think so.
Well, sounds like your bottom line is think about it like a well-prepared trip to the grocery store.
That's right. I think that the risk of in-person voting can look a lot like the risk of going to the grocery store and can be made safer with mask use and hand sanitizer. And so there are ways to make it safer.
Great. Thanks so much for walking me through this today.
Happy to.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.